Good morning. I'm Lauren Blauvelt. I'm coming to you from Columbus. I'm the executive director of Planned Parenthood Advocates of Ohio, and I'd like to send it over to my colleague, Dr. Kumar.
Hi, everyone. I'm Dr. Bhavik Kumar. I use he, him pronouns, and I'm the Chief Medical Officer here at Planned Parenthood Greater Ohio.
Hi, and I am Erica Wilson Domer. I am coming from the Northeast quadrant of Ohio. I use she, her pronouns, and I am the president and CEO here at Planned Parenthood of Greater Ohio.
I will pass it to my colleagues because we have a lot of important information to talk about with the House just passing the big, terrible bill to take away our access to Medicaid, our access to Planned Parenthood to be able to serve Medicaid patients, and so much more. Erica, how does Medicaid and the ability to be reimbursed by Medicaid matter in providing healthcare? But also, like, why is healthcare so expensive? Like, what are the challenges of being a healthcare provider right now?
Well, I don't know if we have enough time to get into all the variety of reasons that why healthcare is so expensive, but I'll try to sum
It's
it
all I
up,
care
right?
about. It's why is it so
I
much?
know, I know. With this bill, the recent budget bill that's proposed right now, there is a provision that would take away Medicaid expansion. Medicaid expansion was really impactful for Ohioans. There are so many people who are utilizing Medicaid expansion to access health care and to get the care that they need. Um, if there is any change at the federal level, so these things are very much intertwined, right? The federal level budget bill and the state of Ohio. And so these cuts that are happening, proposed cuts happening at the federal level, impact Ohioans to the tune of about 800,000 people in Ohio who will lose healthcare insurance, their healthcare coverage, which is just an incredible number of people who will lose their access to healthcare. And I think there is this mischaracterization of people who utilize Medicaid, right? So I think the Republican Party has sort of tried to create this characterization of people who are on Medicaid as being people who are just unemployed or maybe, don't have resources, et cetera, et cetera. But the reality is that a lot of people who utilize Medicaid, first, the bulk of Medicaid dollars is used to pay for people living in long term care. So people in nursing homes, people who are really, that is a state thing. It's not Medicare. A lot of people think Medicare is covering people living in a long term nursing home, but that's not true. It's state Medicaid. So a lot of our Medicaid dollars are going there because it's incredibly expensive to care for people who are living in long term care, but they deserve to be cared for, right? We care
Yeah.
for our old people and then also, or people who have disabilities, et cetera. Um, and it's college students. There are college students who are utilizing Medicaid. There are people who are we call it underemployed, but the reality is they're doing essential work, right? We have people who are making minimum wage, working 40 hours and plus a week, and healthcare premiums are just unaffordable. Those people qualify under expansion to access Medicaid. So this is why we care about this bill, right? This is why we care about what the Senate is, or I'm sorry, the Senate, what's happening in the Senate at the federal level and what's happening in the state of Ohio's budget, because almost a million people losing access to healthcare coverage doesn't just impact people who are on Medicaid, it impacts all Ohioans. Because if you can't access basic preventive services, if you can't go to a doctor and get seen, and Dr. Kumar can talk a little bit more about that for a preventive issue or a smaller issue, like, I have an infection of any kind in my body and I can go visit a doctor's office to get that taken care of, then you go to the ER, right? Because at the ER, they don't collect a copay. So people learn that if I go to the doctor's office, they're going to ask me to pay up front, especially if I don't have coverage. But if I go to the ER, I don't have to pay up front. And so what happens is people flood the ERs for unnecessary visits, right? Because they can't get access to preventive care. And that impacts everybody, right? Because the hospital cannot sustain patients who aren't able to pay the bill. So commercial coverage prices go up, hospital prices go up. And also the ERs are flooded with people who don't need to be there. And so that means if I have a heart attack or a stroke or I have some other kind of issue, now I'm sitting in the waiting room a lot longer because everybody's at the ER trying to get what they could have gotten at the doctor's office if they had healthcare coverage, but they're being turned away because they don't have healthcare coverage and they don't have the cash to pay upfront. That was a lot all at once, but this is why this is
Yeah.
why we all should care about what's happening to Medicaid.
Exactly. I mean, this is why the Affordable Care Act was passed in the first place, to
Hmm.
ensure that more people would be able to use other healthcare providers like Planned Parenthood. That's why we exist, so that people can come and take care of both preventative care, so you don't get sick in the first place, and if you do have an urgent need, but that can be fixed with your provider, you should be able to go to Planned Parenthood. You should be able to go to your doctor and not have to go to the ER. I think one of the ways that they talk about Medicaid, because you're exactly right, we're thinking about people who use Medicaid as if in some way they're taking from the government. That is a completely false narrative. In fact, like the corporations that are getting the biggest tax cut, like because this big terrible bill is all about making sure that billionaires get to keep their big tax cut or get a bigger tax cut. And they're the ones actually insuring or frankly not insuring their employees, because the patients I think that we see at Planned Parenthood a lot of times are working minimum wage jobs where they're not allowed to work full time because the company doesn't want to pay them full-time benefits. So you're working multiple jobs, and maybe you're also an Uber driver, none of which is giving you access to health care or health insurance, but leaves you qualifying for Medicaid. And you should qualify for Medicaid, and you should be able to see your healthcare provider when you get sick.
Well, I
What do
think
you
this is
think?
part of the like indoctrination a little bit that we go through here in the US, right? Is that we haven't accepted the basic premise that healthcare is a basic human right that we all should enjoy here, right? And that if we're going to spend tax dollars on anything, it should certainly be the health and well being of our general population, right? And by investing in the health and well being of our population, they're able to work. They're able to take care of their families. They're able to participate in community. When people do not have access to basic health care, they can't do any of those things. And their whole focus is on how do I get well? How do I get the resources that I need? Whereas other countries, so many other countries have figured this out. And I would also argue like one of the things I hear from people often is like, well, in the UK or somewhere, I might have to wait 3 months to get an appointment. Well, you know what? You have to wait 3 months here.
Yeah,
If
I'm
you try to
currently
get a
doing
new
that,
primary care provider, you're waiting 3 months.
at
That's
least.
one of the reasons that Planned Parenthood is really a provider of choice for so many people because we often have same day, next day availability, telehealth availability. We're accessible to people in an affordable, time centered way, right? When they need help. And I know because I myself, when I've gone shopping for primary care, it's like, okay, we can see you in November. Okay. Well, by then, whatever my issue was. And even as an established patient, there have been times that I've tried to get an appointment and they're like, okay, our first opening is 3 weeks from now. 3 weeks, by 3 weeks from now, it'll either be resolved or I'll be dead. One of the two. I don't know.
Yeah, we know what we're supposed to be doing when it comes to healthcare access and what people need. I think it's just a matter of prioritizing that, right? And y'all were talking a little bit earlier about the different types of folks that are on Medicaid and accessing care. And it's just about humanity, like human to human, caring about each other. And it's also about community care when people in our community are able to get what they need, access the healthcare they need, be healthier. They are healthier. Their families benefit from that. The families are healthier. The community is healthier. We live in healthier communities together. And that's really what it's all about. It's not a secret. It's not new. It's not a 2025 issue. It's really back to like the haves and have-nots, right? And unfortunately, we knew this was coming with this new administration. This is not new for us in Ohio or in other states in the South and throughout the Midwest, right? But it's just jarring to experience it over and over again. And it feels like the attacks get deeper and wider and stronger and more forceful. And we're moving more away from caring about humanity and caring about people who are the most marginalized, which are people on Medicaid. Like you mentioned, folks in nursing homes, folks with lower incomes. I think more than half of the folks on Medicaid live at or below 200% of the poverty line, which is very little money. So you think about the cost of things going up for us, let alone caring for a family of four and not having more than perhaps $50,000 or $60,000 a year. It's a lot of money to stretch for a lot of people. And then when you don't have access to healthcare, who's going to pay for that? What choices do you make? Right? Do I have dinner or do I pay for, whatever healthcare that my child may need or I may need? So it's a really unfortunate and more importantly, avoidable situation that we're sort of approaching. And it's not surprising, but still really jarring to experience. The other thing I wanted to mention is that as a healthcare provider, we see these folks when they no longer have access to the care that they've had for so long. And they ask us the questions about why they can't see us anymore, why their healthcare isn't covered anymore. And they don't want to hear about what the government did and what cuts were made. They want to hear, what can you do to help me get this care that I need today? And we have to fill in that gap. No matter what the government does, we have to show up for our patients and try to do the next best thing. And we're happy to do it. It's exhausting to have to bend and shift and meet the needs of our patients, but that's what we do. And I think that's what also gives us joy, as difficult as it may be. It gives us joy to say, you want to mess with our patients, we're going to show up in this different way, and we're going to do what we can to make sure they can get as much of the healthcare that they deserve. And so I'm starting to think about some of those things that we're going to start to have to do, and how the conversations we're going to have with our patients, and all of that is definitely weighing on my mind right now.
You're so right that this is preventable, and it's actually still preventable. This big, terrible bill has not passed yet. This is a prime time for all constituents. So wherever you're tuning in from, you should be calling your U.S. senators. Here in Ohio, we're really focused on Senator John Husted, who is brand new to the Senate. He wasn't elected. He was appointed. It happens. And he is still, he has a lot to prove to Ohio voters on the kind of leader he's going to be. And this is a prime opportunity for him to show leadership. Ohio is one of the most impacted states from losing the Medicaid expansion. It's like a list of 5 states. All of them are huge population centers. In fact, I think people think Ohio is a small state in the middle of the country. And, size-wise, who knows? But we have 11 million people living here. We're the 7th largest state. So when you're talking about almost 1 million people losing access to healthcare overnight, that's a huge deal. And it's going to impact our business. It's going to impact our communities. John Husted has the ability to stop this. All Republican and Democratic congressmen do. It's their budget. But if you have not called your senator yet, you absolutely should. And if you have already called, you should call 8 more times. They need to hear from you. They work for you. They represent us. John Husted, Bernie Moreno, they're the 2 Republican senators from Ohio. They have the next say on this bill. They have the next vote. They don't get to pretend like this isn't their fault. Ohioans losing healthcare is their fault. If they're able to save it, then I will thank them. I did not vote for them, but they will have my support, because it's not about what party you belong to. It's about taking care of our communities and making good financial decisions. It's both, because what is good for our community is also what's financially best for us collectively living here in Ohio.
Absolutely, Lauren. And you bring up an excellent point, because both Moreno and Houston didn't run, right? So let's be clear about that. But theoretically, the platform has been economics, right? I think we could all argue that this last election went the way it did largely based on economics. And the reality is that all of these choices that are being made in this big, terrible bill are horrible economics, right? Terrible economics. It's adding to the deficit. It's adding to the national deficit, which, strangely enough, that party has said is their deepest issue for how many years now. And yet they want to add trillions and trillions of dollars to the deficit, but they want to cut services for our most vulnerable community members who we want to fully participate. But I don't know how you're supposed to fully participate when you have no health care, you have no education, you have no access to community resources, let alone from a healthcare perspective, Dr. Kumar, we'll have to get into like all the research funding that has been cut.
Mm.
Like, I don't know about y'all, but I have people in my life who have cancer, who have diabetes, who have other illnesses that all of the research funding is being cut, right? How are we supposed to continue to be a leader in healthcare, a leader worldwide in innovation in healthcare when all of the research dollars are being cut? For a party that says they want a lower deficit and who says that they want to support families and they want to support, they want to bring back this vision of they're doing everything they possibly can to do away with everything that supports families and supports community and adds to a deficit that our children and grandchildren are going to be saddled with, right? Like
Hmm.
none of it makes sense. It's genuinely baffling to me.
Coming from Texas, I think one of the things I've learned is you can't make sense out of nonsense, and it's just more nonsense, and it doesn't make any sense. It never makes sense, still doesn't make sense, and they just keep spewing out the nonsense. It's so much nonsense.
They know it is. The response to the market crashing. I know we're not the experts on tariffs, but I'm sure all of us cared about the market crashing too. Is
Yes.
they were like, well, we should all be in pain together. Like, be in pain for the leader. Like, that was like a message that went out there, and I was like, this is not the country for that. That's like why we have representatives. That's why like it's so important to like connect. Like, these decisions are being made by real people who are not different from you and I, except that I think you and I, like all of us, are showing up to everyone we work with are just trying everything they can to serve our patients and our clients. And I think our clients are doing the same thing when they go back out into the world. Like, how is it that we just elected the only people who are like, yeah, we don't care if you get sick or die or lose all of your money. We are going to have more money though, and that's okay. And I think at least we can call them out for it. And you don't just have to like call them out. You can call them directly and say, I use Medicaid. I need you to protect it. Or I don't use Medicaid, but I think that my taxes should continue to pay for Medicaid. That's better for the community. And you should be working on ways to make all of our healthcare cheaper and more affordable and more accessible. That should be their focus, because every single person living here has and will need healthcare. Like, this is universal. It is a universal human right, and it deserves to be treated that way. But first and
I
foremost,
mean, it should be. It should
it should
be
be.
a
Yeah.
universal human right, right? I think we all can agree on that. If I'm sick, I want to get cared for, right? If my partner is sick, I want them cared for. If my child is sick, and yet it's conditional. And I don't
Mhm.
understand why in this country where we're supposed to care so much about our community and there's so much wealth in this country, and yet basic human rights are conditional. Yes, to your point, Dr. Kumar, we are supposed to care. And so one of the ways that listeners can care is to text care and CARE to 22422. Um, and that is how you can tell your senators why they should vote to protect Medicaid and Planned Parenthood. Let's get into that a little bit too, because I think that's important to understand this defunding of Planned Parenthood, right? So there is this like myth that I would say Republicans often like to perpetuate, that funding Planned Parenthood is funding abortion. And that is simply not true. It is just not true in any way, shape, or form. It never has been. I can tell you as a CEO of Planned Parenthood and a former CFO, we have been audited by every conceivable agency that can ever come to audit. And never once have they found not $1 of federal dollars or state dollars that go to fund abortion care. It just doesn't happen. Um, and so I think that is really important to know. What they are defunding is basic preventive care and urgent care, in the sense of people have infections, people have life issues that come up, right? And that's what we care for. That's what we care for here at Planned Parenthood. So what they're stopping, what they're defunding are preventive wellness visits, exams. Dr. Kumar, you can go into like all the millions of things that our clinical staff do that keep people healthy every day. That's what they're defunding.
Yeah, absolutely. It's rare to have any funding from Medicaid, and if it is, it's from the federal level for abortion care, and it's only for rape, incest, or sexual assault. So it's a handful of folks that we're able to help, unfortunately, each year. Even though that narrative is perpetuated, the vast majority of the over 50,000 Medicaid patients that we see in a year are coming in for STI testing, treatment, access to contraception, including emergency contraception. So definitely time sensitive and essential care, but also cancer screenings and cancer prevention with breast cancer screenings, pap smears, colposcopies for cervical cancer, well women exams, well person exams. We offer primary care. So there's a lot that folks can access with us, and all of that is what they're attacking. I think the other important thing to note, and this is from my experience in Texas, where we went through something very similar a few years ago, is that when we suddenly shutter access like this for tens of thousands of people, there isn't another place for them to just make another appointment and access that care quickly. They have to find another place. They are going to be overwhelmed with all of these patients trying to access care with them, which means longer waits, not able to get an appointment that meets their needs. For example, evening appointments or weekend appointments like we have, telehealth appointments that we have so folks can access care on their own terms, things that folks need in their very busy lives that we understand and try to make sure we can accommodate for. They're not able to have all of that. And so sometimes that again means that they have to forego accessing healthcare and potentially stay unhealthy or not make the healthiest choices against their will. And that's not what we want for our community members. That's not what people deserve. So they really are attacking people who are most vulnerable and need this time-sensitive, urgent care. And there's really no alternative. And that means people will suffer and not get the care that they need. Folks that are trying to treat their infections and prevent pregnancies if they're not ready to be pregnant, and trying to do the right thing. But the government is really making it harder and harder and putting up obstacle and hurdle after hurdle, and just pushing them further into, more oppression. And again, there is an alternative. Just let us do our job. Let us see patients and take care of them. We're really good at it. We enjoy it. We want to do this work. And we really have to get away from the false narratives that they're trying to paint and look at the reality of what we're experiencing and what it means for the people that we're trying to take care of.
Well, and to your point, Dr. Kumar, from an economic perspective, Planned Parenthood is one of the lowest cost, high quality providers in this state. So even in the Title X program that we were just defunded from, right, again by the Trump administration, when you look at what was awarded, I think the state of Ohio got, was it like $6 or $7 million in Title X funding. We received $2 million in Title X funding. We saw only 500 fewer patients. So 600, sorry, fewer patients for $4 to $5 million less.
Mm-hmm.
So we are a good economic bet, right? Like we are efficient. We give quality care that people actively seek out. We are available evenings and weekends. We do everything we can to break down barriers for patients to get access to care. And that's what they're defunding,
Mm-hmm.
right? So we are the best economic bet, and yet we're the ones getting defunded.
And that's because it's a political fight. They like the political message of attacking Planned Parenthood when the reality is they're attacking Planned Parenthood patients who should be able to maintain Medicaid and should be able to use it for their healthcare provider of choice, who's in their community. And, we don't get money directly from the government as like a whole grant. It's completely directly connected to being reimbursed for the healthcare that is provided. And Ohioans should get to choose who their doctor is. They don't need their elected officials making that decision. And that's why in the 2024 election, you heard President Trump and Vice President J.D. Vance say that they weren't going to attack Planned Parenthood and they weren't going to attack abortion because it wasn't popular, and they took it off of their platform. But here in their first budget, it's defunding Planned Parenthood again, because they're not listening to voters. They're just listening to, their donors and the small minority of people who want this.
Well, I mean, that's really clear because the Congressional Budget Office said that defunding Planned Parenthood was actually going to cost $300 million more
Right.
than what we currently receive, right, through various grants and fee for service Medicaid. So the defunding of Planned Parenthood actually contributes again to the growing deficit that this administration continues to build on. So they have this narrative in the news of we're making all of these cuts, right? We're doing all of this cost saving, but the deficit continues to grow. So make it make sense. I think it's a lot of false narrative that just doesn't make sense. And the reality is that these cuts are happening so that the wealthiest can get tax breaks, which they posit means that they will funnel down to other people. We all know that's not true. We tried this with Reaganomics. It did not work, right? I think that economic theory has long been discarded, but the reality is that everyday Americans, to Lauren's point about what the Trump Vance ticket sort of ran on economically. I mean, I don't know about y'all, but when I go to the grocery store, all the prices, not just the eggs, all the prices continue to grow. I think tariffs are hurting small businesses. I have a good friend that has a small business. She is really worried about how she's going to continue with her small business.
Our supplies are also costing more. By
Yeah,
the way. With
medical
tariffs,
supplies are costing
yes.
more. So when we talk about ballooning healthcare costs, right, all of the costs just continue to grow. So this Trump Vance ticket, who said like within the first week they'd have all the prices down, has done nothing but overinflate and create a larger economic problem. I think too, what we have to really understand, and particularly in Ohio, is that Republicans have controlled the House and the Senate and the supermajority for how many? Almost 2 decades now. So if we're unhappy with the economics of what's going on here in Ohio, we can look no further than Columbus, where the Republicans have been in the supermajority for almost 2 decades. So they have created this economic climate. They have created this maternal health crisis that we have. They have created the STI crisis that we have. And they continue to pass horrible policy that does nothing but grow all of those things. All right, I want to let Lauren talk about the incredible corruption that is Senator Husted.
There's a documentary on HBO about Ohio's corruption, so everyone can check that out after our episode ends. Just about like all of the dark money, the House Bill 6, the $2.1 billion government bailout of First Energy, the pay-to-play bribery, all of, this ended up with the Speaker of the House, Larry Householder, being found guilty of racketeering. But Husted is part of this group, just like Governor DeWine is. He's been opposed to Planned Parenthood. He's very anti-abortion. He's very interested in making sure there's payouts for his friends, but not access to healthcare for the community that he is representing. And we see that in his support for crisis pregnancy centers, which now are getting, so this is switching to the Ohio state budget, where they're cutting public schools. They're giving $600 million to the Cleveland Browns, but they're also giving $20 million. It's $10 million a year to crisis pregnancy centers, which are fake clinics, which are allowed to tell you whatever they want, anything to persuade you from having an abortion. That's their purpose. They often are right next to actual abortion providers like Planned Parenthood. They want to be tricky. They want to be sneaky. And
yeah, can I tell you, one of our staff went secret shopping at the crisis pregnancy next door in Columbus, and they literally showed her an ultrasound photo. She was not pregnant, by the way, but they showed her an ultrasound picture of a pregnant person and said she was further along than she was. They gave her all this misinformation. Like, really, it should be criminal what goes on there. This person was not even pregnant and got showed a picture of a pregnant uterus to tell her she was further along than she was. incredible. It's incredible. And this is what the state wants to fund and give tax credits to people,
Exactly.
by the way.
Firstly, there's 15, we're like 15 to 1. So for every Planned Parenthood in the state of Ohio, there's 15 crisis pregnancy centers. So that's 15 times more likely that you're going to walk into a pregnancy center west, whether that's to have a conversation about your options, to get your abortion, you've already made an appointment. They will purposefully bring you into a room where you can't leave. So if you miss your appointment, that is it's hard to get an appointment, unfortunately, because of all the closures, everything we faced over the years. And of course, you will get an appointment. You will get an appointment with us, and we will make sure you know that you're going to us. But the point is, behind the scenes, like, this is their purpose, and they're getting millions of dollars. Again, we're not getting any money. We're regulated. You talked about us getting audited. The Ohio Department of Health comes in. Like, we have to prove every single thing that we're doing is legit. And I think we're all happy to do that. And in our own way, like, it's like, people deserve to know that they are getting high quality healthcare, that the money that goes into our healthcare is going directly to serve patients. You know, we're a nonprofit. We talked about for-profits at the beginning. Like, we don't make money off of what, we do. We are just here to serve the community, and all of it is monitored. But there's no accountability for crisis pregnancy centers. They don't have to prove the impact. They don't have to show their work. They don't have to show where these dollars go. But Planned Parenthood does, other nonprofits like healthcare, and they're not HIPAA. Everybody has to sign, like, patient privacy. They are not held to patient privacy. We are. So it's dangerous, and the government continues to give them more money and now more benefits, because there's a tax write-off that if you, in the Ohio budget this year, in addition to trying to cut Medicaid and add work requirements, and if the federal government cuts Medicaid, then they're going to get rid of Medicaid expansion. All of this nonsense, they found a way, without any hearings, to sneak in a tax credit for their friends. So if you give so much money to a crisis pregnancy center, you can write that off on your taxes. $750 you can write off if you give to a crisis pregnancy center. And a lot of Republicans own crisis pregnancy centers, or their friends or their donors do. So it's all very, like, connected and circular and
Incestuous.
Yes, very incestuous, and more of the corruption. I want to talk about these work requirements for a hot second, because these work requirements are they're infuriating. First of all, so many people on Medicaid are working, right? Or they're trying to get an education, or they're trying to raise, et cetera, et cetera.
Or they
But
can't work.
also, like, this
Like,
was tried in
physically.
Arkansas, and it cost so much money, right? Like, they tried this in Arkansas, and it
You
ended
mean
up
we've
costing
tried
them
this
so much
before
more.
and it didn't work, and we're doing it again? Is that what you're saying?
Yeah, well, because this is what
Wow.
we do,
Is
right?
that the definition of insanity?
It is. It is. It's insane.
We
Yeah,
should
in
be in it
Arkansas,
for the
they
pain.
implemented these work requirements on people for Medicaid. And what ended up happening is people just were losing their Medicaid coverage, right? Because you have to, like, file every week proof that you're working. And so if you're working, clearly you don't always have the time and ability to, like, do all the, and we always make bureaucracy, like, way more complicated than it needs to be. So people end up losing care. But then the administration of these work requirements costs so much money, because you have to build a whole system to administer these work requirements that you don't make back. So this is a giant waste of money to strip people of their right to essential health care, which is what we've been talking about. Like, can we just all agree that people should have basic health care, which ultimately saves all of us so much more money? Like, if we give people Medicaid and they can access preventive care, guess what? They're going to stay out of the ER, which costs 10 times more than what it costs to visit one of our health centers for basic care, or any other community health center for basic care. It just makes good economic sense. So all of this, like, requiring ridiculousness from people and for purposes of ideology is, like, terrible economics. It's just terrible economics.
And Lauren, you were just talking about the crisis pregnancy centers. I think we can do a whole episode on that, like the
we
number
will.
of stories from patients and like things they've shared. I think just I mean, they're really not clinics. They're sham setups, and their whole purpose is to persuade people to not have an abortion. They are not giving full options. We are giving people full options. If somebody says to me that I don't want to move forward, you don't move forward, right? And if you do, then we move forward. That's what we tell people. And if somebody leaves and they say we want to come back, then you can come back. Like, we can help you with not being pregnant if that's what you choose. They are not doing that. They are convincing people and lying to them. And our tax dollars, most importantly, are funding that. And so it's really egregious when you think about it.
It really is. And I think that's what we're trying to do here. Like, we recognize that there are a lot of big systems working against us, trying to figure out your healthcare situation and where you can find the right care and how you can pay for it is hard enough on its own without the government trying to make it harder, whether that's by trying to get rid of your healthcare provider like Planned Parenthood, whether that's cutting your health insurance like Medicaid, whether it's sending money to organizations that are actually there to confuse you and to lie to you. Like, that's all really challenging. You know, we recognize that it's going to take a lot of us coming together to share the trusted information, the information that can help you, whether that is making the right healthcare decisions for you, or the right voting decisions. That's what we're coming together to do. And so I hope that you will join us in calling your U.S. senators, especially if you're here in Ohio, call John Husted and Bernie Moreno and let them know that you don't want to see this big, terrible bill move forward.
So, Lauren, I'm sure people listening are really angry with what's going on and probably want to do something. You mentioned that House vote earlier that happened, and that passed by one vote, right? It was 214 to 215. Exactly. The Senate is about to take this issue up, and so this is the time that folks can do something. So tell us what they should or could do.
Please text CARE, CARE, 22422. That will connect you with your senator so that you can leave a message or talk to their staff directly about saving Medicaid and access to Planned Parenthood. So text or call CARE to 22422 and tell your representatives that you don't want to see any cuts to Medicaid and that you don't want to see any blocking of Planned Parenthood in this bill. So stop defunding Planned Parenthood, stop defunding Medicaid, stop this terrible bill.
Thanks for listening. It's going to take all of us for autonomy to rise. So like, subscribe, and share. Support our work by donating to Planned Parenthood Advocates of Ohio. Visit us at PlannedParenthoodAction.org. And don't forget to text CARE, C-A-R-E, to 22422 to protect Medicaid and Planned Parenthood for all.